I see the sign that comes up that says live on YouTube. Right. Annette? Annette?
I'm sorry, I'm here.
I see the sign on my screen that says live on YouTube.
Okay, yeah, it's still spooling on my end.
Oh, okay, okay.
1 second for me.
Almost to the end.
Mm-hmm. It's almost there. Okay, we are live on YouTube. It will be a delay. So there's like a 30-second delay on YouTube.
Okay. Okay. Well, good evening, everyone. Welcome to the Belvedere Seventh-day Adventist Church. We are in the middle of our summer explosion, and this year we have been dealing with depression and how that affects each one of us. And so we have two wonderful presenters this evening in the persons of Doctors LaNina and Sanders Mompremier. They are Christian professionals. Dr. Sanders is a psychiatrist, and Dr. LaNina is a psychologist, and they have had years of experience working with those who need their services. And so we are privileged to have them with us this evening. They will do presentation, and then, of course, you will have an opportunity to ask questions. So as we begin our time together, I'm going to invite you to join me in prayer. We thank you, Heavenly Father, for the privilege we have of sharing together this evening. We thank you for our presenters. We pray that as they share with us this evening, that the information they share will be of value to each one of us. We thank you for equipping them and for them making their services available to us. Thank you again for being with us as we work together in Jesus' name. Amen. Doctors Mompremier, welcome to the Belvedere Church. We are so glad you're here. The time is yours.
Thank you so much for the invitation, Pastor.
Very welcome. Good to see you too.
All right, good evening, everybody. I'm glad to be here to be able to share some information. I guess we should probably see if we can get ourselves set up to share.
Can you guys see the screen?
Yes, we can.
All right, let me put it on slideshow.
Okay.
Oops.
Good.
Thank you from the beginning. All right.
All right. Hopefully you guys can see our screen very well.
Yes, we can. Yes, we can.
Like the pastor said, I'm Dr. Sanders Mompremier. I'm a psychiatrist. Finished my training here in Atlanta at Emory University, and that's where I met my wife. And we've been practicing for, well, I guess, oh man, I didn't want to add the years. I guess I'm getting old. I guess I completely finished, graduated from Loma Linda University in 2001 and completed the fellowship and residency trainings in 2007. Now, what I'm going to do, and it's going to go through a really quick presentation of course, depression. That way we're going to be talking about the same thing, and when we're toward the end, when we're talking, trying to answer questions. Now, this is going to be a quick overview. What I tend to find when I do these short talks is people get a lot more information, I guess, through the question and answer session, but I think it is important to somewhat lay the groundwork. My wife, I think, picked up the anxiety portion
And
of
stress
it
management.
and stress management piece. Now, to dive right in, when we're talking about depression, everybody has some times where they're unhappy, some sadness. And that is just part of the human existence. It's just part of life, essentially. There's no way that somewhat be avoided. And a lot of those painful feelings in appropriate situations are appropriate, necessary. They don't last forever. They're transitory. And in some circumstances, you may even hear about that it presents the person an opportunity for growth. But sadness and depression are not the same thing. See, when sadness persists, when it continues on and starts impairing your ability to lead your life to the fullest, the way you need for you to be able to do what you need to do, then it shifts from just essentially regular sadness to what might be considered, I guess, more depression in a clinical sense. And so the difference really between just sadness and depression is just how severe it is, how long it's lasting, and what else is going on and you're struggling with around the same time. One of the things that I talk to my patients about all the time, most of the things that we deal with in psychiatry are normal things, normal life experiences taken to an extreme. Now, depression in the country is probably no surprise to anybody on the line or the call today. It's fairly common in the US and across the world. So typically we're running, depending on the age group you're looking at, the population you're looking at, the prevalence in any given year, and what I put up there is for 2017, which is typically the latest information that the NIMH, the National Institute of Mental Health, and the other organization carry. They're usually about 2-3 years behind. It runs about 10% as far as how what the prevalence is or can be, I guess, in a given population. And why is this somewhat important overall? Because it's not something that just something that affects that one individual. You cannot understate essentially the negative effects or the consequences of a young child essentially being raised when there's a parent who's depressed. So it affects the children in a household. It affects relationships, of course, marriage relationships can be affected when one of the partners is suffering from depression, because you have one person who's somewhat depressed and the other person who's not in their shoes and just not really being able to understand what the partner is struggling with and why there's such difficulty for regular routine life things. This next what I put up there, the data is obviously quite old. From 2003, there was a survey, some economic people who their estimate was about half of the nation's excess lost productivity time can be tied to depression. So again, it can affect the parental and child relationships. It can affect the marital relationships. It affects people on the job. I know I get a lot of folks that I see in the clinic all the time where their mental health difficulties, depression, or otherwise is affecting their ability to perform at work. And depression also accounts for a significant amount of time lost when it comes to productivity, just because of also other illnesses that people come in and present with and have to go to the doctor to talk to them about. So they're estimating it costs the country billions of dollars each year, directly and indirectly overall. So this is a big issue. Now, of course, the ultimate worry that we have as far as bad ending when it comes to depression has to do with suicide. Now, the average suicide rate in the US, again, this is going back to 2017, which is the latest that these organizations, the CDC and other organizations data set goes to, there's about 14 per 100,000. Now, suicide, when you're looking at the country as a whole, is the 10th leading cause of death. Now, if you just look at the younger children, young adolescents, high school, teenage years, young adults, it's actually the second leading cause of death, only behind unintentional injuries, as far as accidents of whatever ilk. And you know, kids can get into stuff, so, but that is the only thing that leads, exceeds, I guess, the cause of death in younger folk overall. And in this 2017 data set, they talked about about 4% of Americans had contemplated. Now, this is not they acted on overall, but actually had thought about during that year actually ending their life. Now, you know, there is a lot of talk about a lot of societal problems, and one of them is homicide. But one of the things we forget, typically, there are twice as many suicides than there are homicides. And we know there are a lot of homicides. For this particular year, we've done about 47,000 plus suicides versus 19,000 homicides. So just to keep things in perspective, yes, one human killing another is a bad situation, and obviously a societal, major societal problem. But if we actually put in the number of suicides, we have over twice as many people who end up dying in this country at their own hands as opposed to the hands of somebody else. Now, one of the things, at least that's interesting for men overall, is the rate of suicide tends to increase as they get older. Now, that's separate from, we may have women who attempt suicide more frequently than men, but I just was bringing this up because a lot of times we think about it, and more so women, but we can't ignore the fact that it is also men, even more of a problem as they get older. So it's just the rate. Yes, women may attempt more frequently, but men actually end up killing themselves at a higher rate than the female counterparts. Now, you know, what can be some signs, some symptoms that may come along or travel along with suicidal thoughts and feelings, just so folks are aware if they're either one dealing with it themselves or have somebody that they are close to who may be either talking or exhibiting some of these things. Well, one obviously is talking about the feeling of wanting to hurt themselves or wanting to die. You might have some folks who just talk about feeling hopeless, essentially that nothing will ever change. One of the powerful things that we have as far as our mind is, as human beings, we can endure a great amount of hardship if in our head we know that it's temporary. Once we get into a situation where we think that these situations, whatever it is, will never end, then you get into hopelessness. And that's what makes a big shift with people in general, is their hope that things could, might, or will get better versus not. Then there's feeling of helplessness, essentially that, and that ties also with hopelessness, where nothing I do or nothing anybody will do will make a difference overall. Folks could talk about, or you can get the sense that they feel that they are a burden to their family and friends. You always have to be careful as far as when there's abuse of alcohol or any other drug, especially if it was not something that was an issue before. If you might run into some folks that are what we call putting their affairs in order. I was talking to somebody earlier today, actually, whose mother got concerned because she was talking to her mother.
You're just joining us on the prayer line. I am here to kind of redirect you this evening. We are having a meeting tonight on a different number.
What I was mentioning, I was talking to a patient earlier today whose mother got concerned because she called up her mother and wanted to make sure that the life insurance policy was in place and making sure that people knew, okay, what to do in case something happened, and that raised alarms and concerns for her mom. Obviously, writing a suicide note. And you have some folks where they are not at a point where they are willing to actively do something to end their life, but you have somebody who was typically cautious and now putting themselves in harm's way, doing things that they know would have a high chance of causing harm. I mean, an extreme case at this point is, we might be familiar with the phrase of suicide by cop, essentially where I'm going to do something, put myself in a situation and be threatening to have them pull the trigger on it. Now, when someone is intent on harming themselves, that is always something that causes a great alarm, obviously, and I can't leave or walk away, I guess, without making sure that people know to make sure that they call 911, call the doctor, call the emergency room to try to get immediate help. Make sure that the person, as much as possible, is not left alone. So if they're on the phone, you keep them on the phone until the 911 personnel arrive. So I've had a lot of folks who that's what they needed to make sure happened. And whenever there's concerns as far as somebody's safety, just minimizing risk as far as there've been patients who've been stockpiling their medication, like their blood pressure medication or heart medication or what have you, that they're not having access to a large stockpile of medication, that the weapons are locked away and secured, and any other item that might cause risk is also secured. Now, that's dealing, I guess, with the big elephant in the room up front. But to back up essentially a bit now and just look at major depression, what it is that what we talk about when we use that word in a professional sense. Again, it's not just sadness. It's not, my mom died or somebody close to me died and I'm grieving. This is beyond, above and beyond what would be expected for a particular situation. Now we have a book, we call it the DSM, the Diagnostic Statistical Manual. Right now we're on version 5 that actually lists out a set of 9 essentially things that we are looking for to see how many of these, for lack of a better word, check boxes that somebody's struggling with before we apply the label of major depression or have the person's having a major depressive episode. And what we look for in that checkbox list is we're looking for, are there at least 5 of those things that the person is struggling with most of the time, or at least more often than not over at least a 2-week period. And this has to be something different from what their baseline is. So one of those things is obviously depressed mood. Are they down, sad, or sad essentially? Now, the one caveat to criteria number 1 is when you're working with or dealing with children or adolescents, what you see and what they express might not look like the typical picture in your head of what we would call melancholy depression. Somebody's just, I'll go through the rest of the criteria, but no energy, there's just no interest. What you might see in younger children, adolescents and younger children, is irritability, more so than sadness. So we have to keep that in mind when somebody's younger. 2, is there either complete or noticeable decrease in their just ability to enjoy things? They used to love doing X, Y, and Z. Even now they have no interest in doing it, or even if you get them to do X, Y, and Z, they're just not having fun, or you're not having fun overall. Now there can be a change in appetite. Now it can go either way. There's some folks where they get stressed and where they're struggling with either mood overall. Some folks don't eat other folks, when they're upset, probably a lot more of us, when we're upset, we eat more. So it can go either way. And same thing when it comes to sleep. You have some folks where they cannot fall asleep, they're struggling to sleep, and it used to be an issue. Other folks who are just, that's all they do. That's all they're wanting to do. You can have some folks where increased sense of, and this again can go either way, of course, agitation. You have some folks who are just, this restlessness, I guess, that they deal with. And other folks, now, they seem like they're going through life, like they're walking through molasses, everything just intense slowness. Energy can be affected, of course, fatigue. One of the things is there an excess of, at least sort of excess guilt? You know, there's every one of us, there are things that we wish we could have done differently or do differently and all that kind of things, or, but you can have a situation where they're applying more guilt on themselves than is actually warranted. And worthlessness can be an issue. People's concentration can be affected, and of course, number 9, of course, recurrent thoughts of death or suicides. Now, there are some other things that that's not officially on or a list, a checkbox, that you can see quite often. I mentioned hopelessness earlier in a talk. Social isolation, or they're just not into talking, just communicating or interacting, I guess, with folks like they used to. Low self-esteem can be worsened or come about. Extreme sensitivity or rejection to failure. So we're talking about if you talk to them about, if you mentioned anything that they did that wasn't perfect, for example, you know, they're taking that as complete rejection and their failure. And of course, those sort of things can affect relationships. Now, I mentioned with children, you might not see the typical sad face or feeling all the time, where irritability can be a big thing that you see. Other things that might be a little different or more so here in children is just a sense of boredom. Yes, you know, there's kids where you know, they need to be entertained all the time, but now it's like, it doesn't matter what it is, they're just bored all the time. Now, one of the things that we do hear about, especially in elementary kids, just because they don't have the language of emotion to be able to tell people, the adults in their life, what it is that they're feeling inside, you hear a lot of physical complaints. So you hear about a lot of stomach aches, you hear about, or headaches. These are things that you can't, they can report it to you, but you can't quantify. You have to take their word for it. But like I said, it's for them, it's just because they don't have the language to say, oh, I am depressed. They know they're not feeling well. And all these physical complaints then can lead to absences from school. And well, even without the complaints, you can have somebody who was performing well academically who now is performing very poorly in school. Now, one of the things I just wanted to touch on as far as, you know, what causes or leads to depression or any other mental illness for that matter. And what we settle on, more or less, I guess nowadays, is, but it usually is a combination of a number of things. Biological, I put on the slide here. I mean, we right now conceptualize how we think about mental illness is no different than any other physical disease, as far as there is something wrong happening in a body. Just like if you have asthma, you know, there's problems with the lungs. If you have diabetes, you know, pancreas problems, you end up with diabetes. You can have heart problems. It's thought of and conceptualized no different than any of the other medical problems. There's a physical, biological situation that's happening that can contribute to the depression or the other mental illnesses. Along with the biological, you can see that there's a strong family genetic link One of the things that's always interesting or fun to look at is they look at twins. And if you have one twin, identical twins, if they're looking at identical twins, if you have one twin who has depression, there's a 70% chance that the other twin will or may also suffer with depression at some point. Now, this is even if they were separated at birth and, and raised in different families, have different life experiences and all that kind of stuff. If one twin has it, the other twin has a 70. Again, it's not 100%, but it just shows that there is a strong genetic link because they weren't even in the same household. They didn't even have the same life experiences. It's that high. Psychodynamic, another perspective that can play a role into this psychodynamic, what we call psychodynamic, as far as some conflict, some drive, some trauma that somebody's struggling with that increase their vulnerability or chance that given a certain situation, given a certain set of circumstances, might push them to having depression versus somebody else. Social, of course, the person's environment, continuous or frequent exposure to violence, neglect, abuse, poverty is listed there. Folks well, now more folks are being aware of just the stress of being a minority in America. There's chronic social stressors that just piles on and makes things more difficult, and more likely that two folks given the same life experiences, one of them might push them to having depression versus not having depression. Now, treatment I just touched on very briefly. Obviously, there are folks can work with their counselor and therapist to help them see how it is that they're looking at things, how it is that they're approaching life situations. What are the thoughts that automatically come in their heads that's driving some of the feelings that they're having. And that can definitely be, and there's different schools and different strategies, different approaches to therapy. What I tell folks is, actually in my clinic, if they're working with a therapist and things are not working, it's like, those are big boys and girls. They'll be fine. If and they all had to learn different strategies before they can graduate and get their degree. If the way things are going with, between the two of you is not working, let them know. Because let them know what it is that you're not getting, what it is that you're needing, and then chances are they can adjust or find somebody who can adjust. Now, of course, medications at times may be recommended, and there have been several studies that support at least a combination of therapy and the medication. A lot of times can be most effective for most people. Independently, they both are helpful, but for a lot of folks, it may need to take a combination of both for it to be most effective. I just put up this one slide just since I brought up therapy. At least in one of the schools of therapy called CBT, Cognitive Behavioral Therapy, it talks about a triangle that are interlinked, essentially. On one point of that triangle, you have your thoughts. What we think affects how we act and how we feel. On another point, you have behavior. What we do affects how we think and how we feel. And on the other end, how we feel affects how we think and what we do. And so a lot of times, if you attack any of those things, it will have an effect on the other two. And so that's where, when working with a counselor, they may take a look at what it is, what the thoughts are that come to your head whenever a situation comes up, and challenge you on whether is that actually so. Yes. And at the same time, they may want you to do some of the behaviors that might come along with being healthy emotionally, even if you don't, quote, feel like it. I do tell folks that when you're dealing with depression, it's the natural flow. If you imagine yourself on a raft or a canoe just drifting down the river, it's for folks for the world to become smaller and smaller and smaller and smaller and smaller. There are less things that they're interested in being engaged in. There's less social interactions that they're feeling like taking part of, and you have folks who retreat more and more and more. But one of the things is, even when we don't feel like it, if we, and again, this is, and I admit to folks all the time, this is, of course, easier said than done, because it's going against the flow. But if we can try to, as much as we can, do the things that we would do, were we in a healthier place, it does make a difference. It doesn't solve in and of itself the whole problem, but the more of those points that you're tackling at the same time, the better it is that we can move forward overall. Now, there are some steps, of course, that we can try to take to maintain, I guess, our emotional well-being and health. Of course, these may sound familiar if you guys have been at events for a bit. Of course, eating a healthy and balanced diet, staying away from alcohol and other drugs, make sure we get our regular exercise, make sure we get the 6 to 8 hours of sleep that we need to get every night. That's one of the things the last two I'm really guilty of not having in place right now. Try to find time to relax every day. Now, this is a slide I should put for the general population, but there is a reason we have a Sabbath. There is a reason we have a Sabbath. Learn new and better ways to take care of problems. Learn which activities that make you feel better, and try to make sure you schedule them in. Be intentional about putting them in. Talking to family and friends, having a strong and active spiritual life are things that we can all do to try to maintain our emotional health. Especially in these times that we're dealing with right now, these are not the times to ignore what we've been taught from our youth, I guess, for some of us. I'll usually leave folks with this verse here, first, beloved, I pray that you may prosper in all things and be in health, just as your soul prospers. I was going to turn it over to my wife to tackle, like, stress and anxiety.
Evening, everyone. As my husband was just starting to say, the times that we are currently in this pandemic are definitely creating a lot of stress and anxiety for us all. As counselors are not excluded. We are definitely in that as well. So as I go through these are reminders for me as well to make sure that I practice what I preach, so to speak. And so I just want to thank you guys for the opportunity for the reminder. But so let us first look at stress and understand what stress is, because there is a reason why we're given stress. So if you have children, adolescents, children at all, you want them to be a little bit stressed out about that math exam, right? Because when they're stressed about the math exam, they will study harder. So that stress is actually a positive thing. It creates some motivation, and some drive to solve the problem. Well, when stress is too long and too much, too heavy, then we get to the other end of this particular slide here, where we're running at optimal, but as we have been holding this burden long, anxiety, disorganization, and as my husband just presented, depression can set in, okay, with a huge amount of stressors. Too much stressors can be debilitating. So then when we get to that place, we're in the exhaustion stage. And that is where our biology comes in. As my husband says, there is a lot of biological evidence that depression is a disease just like diabetes and high cholesterol and all of that. When we look at brains, we can say after people died and we slice them up or we scan them on those nice little MRI scanners, we can see that people's brains are different. And there's one hormone that our body creates through our adrenal gland, cortisol, that plays a role in blood sugar regulation, inflammation, metabolism, memory, all of that. And if we experience stress too long, that means our body is pumping out that cortisol too much and it throws off our system. And so you see that the system starts to shut down. We start getting, our immunity to sickness and colds. You let somebody run stress really hard for a few weeks and you will see they'll be susceptible to colds. Eventually they're going to have some digestion and heart problems. They might have a suppressed immune system. They might have more issues with their hypertension, with their asthma, because their system is being stressed. Their body is producing too much of this stress hormone. And so we see that our body we're supposed to have this stress hormone. This stress hormone is helpful. God put everything in order and in balance, right? So when we are in balance, when we, let's see, go back up here, where we're over here, where there's too much stress and too much debilitating, too much anxiety and disorganization, then we're out of balance. And so our cortisol is out of balance. And we see that when the body is supposed to use that cortisol, because, oh, here comes the lion, I need the cortisol to run from the lion. Because that's a really stressful thing, right? Running from lions. Yes, it would be for me. I don't know about you. But for us, that stress every day is like having a lion run after us every day. Our body is pumping this hormone so that we can, fight or flight, and that hormone overfloods our system, okay? And so we see all of these symptoms that come from stress, from too much cortisol in our system, for too much carrying a burden, too heavy for too long. Our muscles get tense, we start sweating, we got chest palpitations, heart beats faster, blood pressure rises, all of that stuff. I don't need to name it all. Everybody who's been on earth and is at least 16 years old has experienced some level of stress, so I don't have to explain. You know what stress is, but did you know that your brain produces chemicals, and those chemicals push you either further into stress or not. And if we experience too much, we have all this myriad of problems. And I categorize them in different sections for you. I already talked about some of the physical. My husband mentioned the emotional, depression, moodiness, angry outbursts, all of that. It affects your brain and being able to think, which we call cognitive, and that's poor concentration, negative self-talk, where I just can't do this, I always mess up, I just can't, I'm overwhelmed and I can't perform. All of that thinking that you have in your head, those negative messages that you have in your head, all of that is from too much stress. And so when we are talking to people and trying to encourage them, we should make sure that we're looking for all of these. We even have spiritual issues because sometimes that stress challenges our faith, or we feel far from God, and we feel like we don't know what our direction is, because clearly there's all of these barriers and walls up. So maybe God doesn't want me to go that direction, and we're kind of feeling directionless. And so we want to make sure that we are aware of each of these things, because stress can kill. Stress can kill. We want to make sure that we know the difference between stress and anxiety. Because anxiety is a vital emotion. So it warns you of possible future risk or problems. That's helpful. So if something's about to happen and I get this feeling this unsettling feeling in my chest, that's a little anxiety, like, I don't know. Maybe that's a warning about what's to come. So it's kind of like a smoke alarm, saying, hey, something significant, pay attention. But as our system gets stressed and overworked and such, it becomes too sensitive and gets triggered often. Some of us have biological vulnerabilities to anxiety, and so our system doesn't require a lot for our anxiety to get triggered, to be overly sensitive and to be triggered. And so it's helpful to talk about this in families. So many families don't talk about, we talk about, hey, cancer runs in the family or heart disease runs in the family, but not that, grandma, mom, and daughter experience panic attacks all the time. We don't talk about the things that happen in our brain, just in the body. And some of our families, some folks' family don't even share the physical part. I talking to some of these young adults, and when I was working in the college, and they didn't know their family history for diabetes, let alone depression. And so we need to make sure we're having these conversations. And so I just want to talk about some of the major anxiety disorders, because as we are in this pandemic and we're stuck in the house and we are seeing the same people every day, and our interactions are limited, and we're not being able to really connect with our friends. Some of us haven't had a hug in weeks. Just being on. A lot of us are in positions where we're working, and there's not a lot of break, and so stress is building. And if we're already vulnerable to depression and anxiety through our biological history or family genetics, then it opens up this unfortunate opportunity for these disorders to set in. Generalized anxiety disorder is this persistent worry, restlessness, tension. It's not related to a specific event. It's just, I always feel on edge, or I just feel unsettled, and I feel nervous, and I just feel this intense feeling of anxiety. That is what we call generalized anxiety disorder. It's generalized. It's not specific like a phobia. I'm afraid of spiders. I'm okay until a spider shows up. That's different. That's a phobia of spiders. But generalized anxiety is in general, on a daily basis, I'm experiencing a lot of tension and stress and anxiety. And then there are panic disorders. And so that's when you have this all of a sudden intense fear. It doesn't have to be logical. I have clients who wake up from a semi-restful night of sleep with a panic attack. Their heart is pounding, their rapid beat, and it's not like they had a nightmare. It's just, I'm woke, I'm about to start the day. Oh my God, I got a bazillion things to do. Oh my goodness, how am I gonna get it? And then it just hits you. And you're having trouble breathing, you're hyperventilating, you have this feeling of doom. And these can come on really suddenly, and you feel powerless and out of control. And the thing is, most people start to avoid things. Like if I have a panic attack, let's just say I have panic attacks when I get into small places like an elevator or MRI machine. So anytime that I might have to go in an elevator, then I'm going to avoid that. I'll walk up the stairs. Those are things that people start to do when they notice, oh, okay, I get panicky. We start to change the situations and change ourselves around so that we don't have to experience that. And PTSD. Unfortunately, my fear with all of the Black Lives Matter videos that are coming up, we are seeing people being tormented and terrorized on TV constantly. And the flashes, the images are constantly in our head. You know, if I close my eyes, I can see that police officer's knee on that Black man's neck. Like that's creating this traumatic event that I wasn't even there to witness. And people who are actually there witnessing it might come home and start to experience a lot of these symptoms: sleeplessness, depression, irritability, nightmares, flashbacks, because our system was not made to behold such violence and horrific things. And it just keeps going in circles and circles. We keep experiencing it, trying to rectify it. Our brain is trying to figure it out and rectify it, but we can't. We can't resolve that trauma because it's already happened, and our body kind of gets stuck in that space. And so that's what we say with PTSD. And I know most people are familiar with it in reference to soldiers. But just wanting to emphasize the point that it's not the stress that kills, it's our reaction to it. Because we all have stressors. Unfortunately, we'll all have some kind of traumatic event that probably will happen to us before we die. And we clearly will all witness traumatic events on TV because the news just loves to flash them on the screen. And so how do we react to it? And so here's some tips and just ways to really kind of structure yourself. And again, we're going back to Eden, we're going back to our basic principles. You know, that anti-inflammatory diet, low sugar, avoid processed foods with toxins in it. We don't want to overload our system. Our system's trying to fight the stress. So we can't give it extra stuff to fight. We want to make sure that we're scheduling our time and we have good boundaries and say, hey, you know, I can't handle anything extra. I'm sorry. I know you put that on my schedule, but that's not going to work for me. Can we do that next week? Or can we do that? You know, make sure that you are judicious about your time so that you don't feel overloaded. Responsibilities, keep yours and allow others to keep theirs too. So don't take up what you ain't responsible for. You got a heavy load to carry yourself. And so making sure that you're verbal about, hey, look, I need you to pull your weight, whether it's someone in the family or someone at work, you know. We want to make sure that please, please, please get your sleep. Get your sleep. Because if you don't get your sleep, your body doesn't restore itself, and anxiety and depression and stress just builds right on top of it from one day to the next. I have some unhealthy thinking patterns that I have included here for you. And I told Pastor that I would give a copy, a PDF copy of the PowerPoint, because sometimes you need to kind of like just sit, read these and stew on them and really see how they might apply in your life, because some of us need to be more assertive and some of us need to look at the big picture. You know, we all have to adjust our standards, especially now that we're in the middle of a pandemic, and focus on the positive, because there's a lot of negative out there for us to focus on. And so making sure that we really think about how we're thinking, you know, whatever is good, whatever is holy, whatever is of good report, think on those things. That's what we want to feed our brain, because we got to keep that cortisol at a healthy level and make sure that your prayer, your devotion, even serving others helps us to feel like we have some sense of control over our lives and things, and that we can contribute to someone else's life. Music is my thing. The folks in my house know when certain songs come on, oh, mommy is stressed. You might want to back up and, you know, think twice before you say some things, because so is playing on the radio, and that means mommy's stressed. And there's songs I put on in particular times just to calm me down. I love a good massage. And think about your environment. I know this might be thought of as a woman thing. My father always said this about my mother. Hopefully she's not listening. But he always said that when she was mad, she would clean the house from top to bottom. Like everything had to be in order. And sometimes you have to do that when you're stressed. You're just like, everything's cluttered and you feel overwhelmed with the thoughts. And so we want to make sure that, you know, we kind of clear the way so that we have an organized mind. I've put some links in here for some relaxation techniques, especially for those of us who really struggle with anxiety, panic attacks, those sorts of things, especially if you're starting to have them from being inside constantly. There's some herbal treatments for anxiety. I know my Adventist folks like to be right next to God and nature, so check out some of these links that tell you a little bit about herbal treatments for anxiety. If that doesn't work, please do talk with your physician before you take anything extra in your body, because I'm not going to tell you one herb might raise your blood pressure while another herb might lower your blood sugar. You need to talk to your doctors. But most of them are familiar with the different herbs. And then when to ask for help. So you feeling rage and apathy and hopelessness, you're feeling like you need to set your life in order because death is coming, please talk to someone. And I have some references here for people who are helping. If you're starting to reach out for something else to help alleviate your pain, like some substance, some person, you're using something to alleviate your pain, reach out for help. You know, if you're feeling overwhelmed and your family members are saying, hey, you might want to talk to somebody, there's no shame in that. There's no shame in that. Because many hands make light work, right? So I've included some resources for you guys. And here's the National Suicide Prevention Lifeline, Institute of Mental Health. These are all good resources for everything. And the references, there's my contact information here as well. I think I have it here on this side. This slide has some places that you can go if you would like to connect to mental health services. There's a crisis text line, Lifeline, Georgia Crisis and Access Line. This is my information. There's also a group of therapists who are offering discounted services for people during this coronavirus, for first responder frontline workers. So I just want to make sure I give you guys all of the resources that might be helpful. And so I'm going to stop the share and open it up for question and answers. I guess we might need to unmute one at a time.
Okay, thank you very much, doctors. I'm sure there are a number of questions. So right now, if you would unmute your device and ask your question, or you can type your question in the chat room and the doctors will answer. The doctors are in the house. Go ahead.
Okay, so I have a question. If someone experiences, let's say, a depressive episode, does it mean, is that a permanent condition, or can that be corrected?
Short answer is it can be corrected. As far as the word that we use, it's, I guess the words have meaning. We do consider it a depressive episode. So it should, the expectation is we will recover.
Okay, thank you.
And just to piggyback on that, if you have a genetic predisposition, if it runs in the family, and this continues to reoccur, then I would say that the person should consider that they might have a continual struggle with depression, and that they might need to make some lifestyle changes to make sure that they're living a life that would reduce the chances of the episodes coming so frequently and lasting so long.
Very good. Any other question?
I have a question.
Good.
You said early on that if someone was contemplating suicide, that you would need to contact the police, keep them engaged until the police get there. What if the police tell you that unless that person attempts suicide, that there's nothing that they can do? What do you do in those kinds of situations?
Gotcha. So if you call 911, and you tell them that is what you're calling about, most of the time, the police may come, but it should also be a medical personnel as far as an EMS vehicle, because what they should do is transport the person to the nearest emergency room for assessment. This is not one of the situations where unless I catch your neighbor harassing you, I can't do anything about it. No, if there's really concerns, what they should do is the person help transport the person to the nearest emergency room.
They will make sure that there is an actual intent. And so
during the assessment, it's that actually, when they come, that's really not their job. It's like,
yes, it's not the police's job to decide. But when you get to the hospital and they're doing the assessment, whether they keep the person or not will depend on their assessment of whether there is real intent and danger and access and those sorts of things. So they're going to assess for that when they get to the hospital. Or the clinic or wherever they're being evaluated, okay? And if that person, sometimes I know I've sent people, they get there and they tell a different story when you get there. And so sometimes it happens that they're not kept. And that is kind of, unfortunately, we just kind of got to start all over and continue to monitor and continue to help and get them until they're willing to actually share.
All right, very good. I think there are about 3 questions in the chat area if you want to check them.
Yeah, so there's one that says, what are the best ways to treat ADHD without medication? So I guess without medication, one of the best things is structure becomes really important. I know this is somewhat off topic for today's talk, but having system in place to minimize distractions when the person, let's say you're talking about a child here, and when they're trying to do their work, because a lot of times they do better with smaller groups, just less interruptions. But the more routine and structured and regimented
environment
is somewhat the best. But like I said, that's not going to solve some of the problem, but it can help the person be successful.
A soldier schedule, wake up, da 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 da.
And we have
meals at the same
routine
time.
things happen in a particular way. And when we're needing to work, we try to limit as much of the distractions as possible. There's one that says, why do depressive conditions manifest more in females than males? That is a pattern that we noticed, but not one that we have an answer for. But it is definitely, it's not imaginary, well, I guess, but this is not to discount the fact that it is an issue in males also, which is why I left the slide in that shows for suicide rate, it actually increases more in males as folks get older, because so it's not something to ignore. Just like eating disorders happen in males also, even though we usually think about them in female, it happens in both.
Dr. Premier, isn't it one of the things that you suggest for aiding in depression is exercise?
Mm-hmm. Yes.
Couldn't it be that men
And
are
anxiety.
more physically active than women, and so that might contribute to the level of depression or the duration of depression?
I'm not sure. I mean, that's possible. That is possible. I think one of the things though that I think about is, does it actually happen more in females than males versus are more women willing to talk about their feelings than men?
Yes.
Like I said, I don't have the answer, but my suspicion is it might be a more willingness to talk about their struggles in emotional terms. Remember, like the kid I mentioned who's having anxiety or depression, who comes to their parents and says, I'm having a stomachache. Because that's the language they know.
Okay, good.
I want to go back to the ADHD without meds question. There are some herbal treatments for distraction and hyperactivity and such. And so, especially if you have a good pediatrician, I know of people who have pediatricians who will offer the herbal stuff first before they offer something that is a prescribed medication. And so you want to make sure that you really have a good relationship with your pediatrician. They might have and your pediatrician might be aware of some things that help treat ADHD naturally. There are a few different types of herbs that do that. We're looking at the next question. If you have a lost one.
If you have lost a loved one.
Oh, okay.
I'm trying to figure out the photos and the memories part.
I think there's somebody you've lost, but you still see, you have reminders. I think it's what the person asking, how can that be dealt with? Now, so, well, I'll jump in first and I'll let you jump in after that. So grief, that is definitely one of the situations where we expect sadness. It's part of the process. Whenever I work with somebody and they tell me, they just lost a person, it's like, there's somebody who's had depression in the past and they tell me now they just recently lost somebody that's close and dear to them. I try to separate out, that is, being sad in that situation is normal. Now, you do run into some situation where you end up with what we call, I guess, a complicated grief, where even beyond the, I guess what would be expected, I guess, time frame, then it is more difficult for them to be able to move on, for lack of a better word. That's not the right wording.
Yeah, nobody likes to move on.
Yeah, that's not the right word. But they're struggling to continue with their daily their daily life.
Struggling to cope.
Yeah. Now, connecting with grief counselors or grief groups is usually where I have folks start. And I know when I was in medical school and when I run into a lot of times, well, there's churches that run these groups sometimes. I need local hospice services, even if you didn't work with them, sometimes are able to provide resources in those situations. Somewhat as an aside, but related to that, one of the things that for me, I think just makes things a little more difficult overall in the society is, in America as a society, we do not have a lot of rites of passage. Essentially things that where there's a ceremony. Yes, we have the funerals here and all of that's there. But if you remember reading back in the Bible, if somebody lost a spouse, there was a prescribed period of time where there were sackcloth and ashes. And this was designated as the mourning period. And the reason I bring that up is there's been a big trend of somewhat celebration of life, which is great. But if it doesn't leave space for people to actually be sad about it, and only thing to see is I have to be strong in light of whatever happens, you're robbed of a part of what is
the grieving process.
Part of the human existence. And even though, yes, we want to celebrate life and the person, but we have to remember that the grieving part, the sad part, the painful part, that's part of the process. And we shouldn't try to shy away from it because or skip over it because for some people, it can make some losses even more difficult. That's not directly to the question, but
and kind of piggybacking on that, in the time of Corona, because I recently lost my grandpa, and so I'm experiencing a little bit of that complicated grief because I never got to see his body. I didn't get to go to New York to bury him. He was buried by a stranger, the mortician. So I didn't. In these times when we're losing people left and right through this virus, you're not even participating in the regular rites of passage, the regular funeral processes. And so trying to figure out what do you do with yourself in order to grieve, because there's no time off from work. You're not going anywhere. You're stuck in the house with a mask. And so really trying to figure out how to grieve. We might need to be creative to figuring that piece out now in the days of Corona, where we can't get up and go. I have pre-existing health conditions, and New York was the hot spot. So you can't always get up and go to a funeral and participate in those rituals. And so that creates a situation where it's even more complicated to grieve. I see a question about anxiety in the midst of working assignments. So what I would tell some of my clients who are saying, look, I get these anxiety attacks. A lot of times I'm working with college students, and so it'll come on in the middle of a class. And I'm like, go ahead and excuse yourself if you can. Go to the bathroom, stand in the stall, run like a lion is after you. Because that helps your body to have some reason for all of the breathing heavy and all of the sweating and all of those symptoms you have. Your brain is like, why is my body acting like this? There's no lion. But your body is having this panic attack, whether there's a lion there or not, right? So you're in there actually running really hard, doing whatever it is to get your body to have some reason to say, oh, okay, this is a reason for all of these symptoms. And then your body will say, okay, now that the running has stopped, I'm going to initiate the cool down period. And will automatically, your brain will automatically start to chill out as your body starts to calm down from that running session in the bathroom stall. That's one technique that really helps a lot of people. Some people just need to, take a break. I know there's some clients I have that I'm like, okay, well, can you go to the bathroom? Can you go outside of the work doors for 5 minutes and just do some deep breathing exercises? Just count, some things that help you to feel grounded, like you're not about to pass out and you're not going crazy and everything. Just start counting the flowers. Just start, touch the ground so that you know that, okay, but sometimes people get to a point where they're feeling as though things aren't real, but you're really touching the ground and the grass. And so those sorts of techniques will help you. And as you work with a therapist, they'll have like a whole treasure trove of different tools. And one works for some people and one works for another. And so making sure that you have the resources, you're talking to someone to give you those resources to deal with those panic attacks. You want to take the last one?
Let's see. Is bipolar disorder curable? How does it manifest in children versus ADHD? So bipolar disorder is a little bit different. Oh, sorry. Let me get back on camera. Shifted. Different from depression, but there was a gentleman who asked a question as far as how we conceptualize depression. And in our head is we have an episode of depression, and then when I talk to folks about it, you might have somebody that never has another depressive episode in their life, or they might go 5, 10, 15 years before there's another episode. My wife did allude to the fact that there are some folks where, okay, this is becoming a more regular pattern, and in that situation, then we need to have a frank conversation about how continuing to have some treatment as opposed to stopping altogether. Bipolar disorder, though, is more of a chronic condition in the sense that, just to back up a little bit, I guess for folks who aren't familiar, when somebody has what we call a manic episode, that's what's required essentially for the diagnosis of bipolar disorder. It's not quite somewhat the opposite of depression. Per se, that's somewhat not accurate. But I think some of the things that somebody can see during a manic episode, you might have somebody where they're going on for days on end with no sleep or very little sleep, but have a lot more energy than usual for them. So it's not, oh, I did an all-nighter now, I'm tired or whatever. This is, they had no need for sleep for several days on end. They can be felt like they're on top of the world. These are the folks where they might think they're, well,
Jesus, or they have delusions, they have special powers.
Yeah, if it goes all the way to where they're somewhat psychotic, sometimes it's just felt like it's not just I'm happy. This is happy on steroids. So that's where sometimes there is that thing as far as it's the opposite of depression. But the thing is that doesn't last. That might be for a couple of days, and then there's a severe depression crash overall. Now they may be more active into more activities than typical for them. You know, this is the person who's going to be might be up all night cleaning their house, and you know, you walk in there in the morning and it's a complete mess because they were doing stuff but not actually accomplishing hardly anything. Maybe in their brain they may be talking very quickly and to the point where their mouth seems to be having a hard time keeping up with their brain. It's just that pressure of speech essentially is what we call it distractibility. So they might, if you're talking to them, like I said, they're talking a million miles an hour, you're jumping from topic to topic. Overall, they may have increased in risky behavior out of character for them. So that's where you might hear stories of folks who, you know, spend money. They just got up one morning and decided today's the day they're going to buy the Jaguar, even though there's no food in the refrigerator. And so you can have like a week or several days essentially of this period where, you know, some combination of these symptoms are all happening, and this is outside of their normal behavior. So it's I should take the side step before what a manic episode is. But to answer the question, we somewhat more or less think of it as a chronic illness that needs to be managed. And what we try to do is decrease the amount of manic episodes and try to manage any depressive episodes.
All right. Thank you very much. We have one other question there, and that's probably the last one we will take this evening. We wish we could spend a little more time with you, but let's take the last question there, and then we'll have a prayer.
Is it better to seek spiritual help before the advice of health professionals if you are feeling depressed? Now, things are different now than, at least that's my sense from when I was growing up. My sense now is a lot more pastors are actually getting actual counseling training degree as part of their process, but not everybody, of course, not everybody. But it is definitely, I think, a trend that I've noticed that more pastors are actual therapists also, because a lot of people are more likely to first connect with the clergy, their pastor, before they would seek professional help. So on my end, there's not necessarily a problem with talking to your pastor first. Now, the hope, though, is as you're working with the pastor, if things are to the point where they feel, okay, now this is outside my comfort level,
the pastor's comfort level, that they will go ahead and refer
or advise that the person then seek other professional help. Now, like I said, the blessing is the more pastors that we can have graduate who are comfortable with actually doing therapy and counseling, the better we'll be.
Yes.
Because if that's who people are going to talk to, Dr. George need to be equipped to be able to help them. So for me, I don't have a problem with that being, if that's the first step. As long as, you know, if somebody comes to, I'm a psychiatrist, I need to have this conversation with some folks in different contexts. I tell them, yes, I have a medical license. I can write for the medication that is used to treat breast cancer, but you don't want me treating your breast cancer. You know, if you want to live, work with the oncologist. Even though technically, can I write the prescription? Yes, but that's outside of my sandbox.
There are also a lot of counselors, psychologists, licensed professional counselors who present themselves as Christian-based counselors. And so if you're looking for that, you can find that. When I have a client that comes into my practice, when I do that assessment of what's going on with them, and then I always ask about their spiritual health and what perspective they're coming from, whether they're Seventh-day Adventist or they're Baptist or they're Lutheran or whatever. And so I have a good idea of the different belief systems of each of those, even Muslim and Jew and all of that piece. And so being able to work with them on their goals for their spirituality. And so you want to make sure that whomever you're working with is open to those discussions of spirituality, open to being able to help guide you through that piece. And when they feel like they've met their cap of their knowledge, able to refer you to someone else.
I think we're probably, and I'll let you close, Pastor. I know you're trying to do the prayer here. I think we both have had folks where we've actually reached out to the person's religious leader to try to coordinate help and support. Because there are a lot of folks where for them, the fact that they're depressed has caused spiritual anguish because it's perceived, if I had more faith, I wouldn't have this illness. Well, no.
It's physical.
That's not, so a lot of times we might need to coordinate the treatment that we're doing outside of the church walls with their spiritual leader. And so if that's important to you, finding somebody who's a Christian or who, even if they're not a Christian, they don't consider themselves a Christian counselor, a good ethical counselor or therapist should respect your beliefs.
Yes.
Wonderful. Thank you so much, doctors. You've been so helpful to us this evening. I'm sure our members and those participating have benefited greatly. And we look forward to interfacing with you again. Thank you and God bless you. Pastor George, would you pray for us, please? Pastor George?
Yes,
would you pray for us, please?
okay. Heavenly Father, we are thankful for your love and your mercies to us. We're thankful for the time we spent together, for the counsels we have received from these doctors. We are thankful, God, that you have gifted individuals in different areas that can be of help to your people, even at this time when there is so much separation between us. We're thankful that you're a God who loves us, a God who cares, a God who sustains us from day to day. We pray that you would be our comfort, our guide, as we travel this journey. We do it with confidence, knowing that you who have created us is with us, and you have promised you'll never leave us or forsake us. Guide us now as we separate one from another. Strengthen us in our walk with you, and preserve us blameless unto the day when you shall come. In Jesus' name we do ask it with thanksgiving. Amen.
Amen. Thank you so much. The Lord bless you. And we will see you again on Friday evening at 7. Again, doctors, Mompremier, thank you so much. God bless.
Appreciate the opportunity. We'll
Thank
you with everyone.
Thank you.
Good night.